Okay, let's start. So we have different, as I was telling you about uh, the different types of spiral bacteria. We have Vibrio type, spirillum type, and spirochete. Spirochete is the most common one, as well as the Vibrio is also common, but most common example of Vibrio is Vibrio cholera. Vibrio cholera is also known as bacterial dysentery, and usually the rainy season it is like very common, especially in my country, very common this infection. So this bacteria can spread by eating contaminated food or drinking water, and it cause a very severe dysentery. In my clinical experience, I never seen a patient with cholera who enter into the emergency department by his own foot. Like more, all the patients which I received with this cholera patients, they were unconscious and they were on the stretcher because of loss of fluid. You know, when there is a hypovolemia, so hypovolemia lead to hypotension, and hypotension can cause loss of consciousness. So this is cholera. Spirillum bacteria, it is a spiral shape, while the spirochete is also a spiral shape, but they are more cylindrical as compared to spirillum bacteria. Spirochetes are more long, their size is more long, elongated, as well as they are cylindrical. So that's why this is a difference between spirillum and spirochete bacteria. So clinically or medically, Vibrio and spirochetes are common bacteria, common form of bacteria. So here, this is a Vibrio cholera. So why we call this Vibrio cholera? Because if you see some of the bacteria, they are coma shape like this. They have a curve. So that's why they call them Vibrio. Helicobacter, it's also a Vibrio form. Helicobacter pylori. It is this bacteria is present in our stomach, and this is the, you can say, the most resistance bacteria which can survive even the acidic pH of stomach. You know, the stomach pH is between about 1.4 or 2, or generally we can say 2 to 3. This is actually the pH. During empty stomach, the pH may, like the pH of a stomach may low as 1.4 or 1.5. And when we are in a fed state, like fed state, or when we eat food, so after eating food, the stomach pH will increase. So it may be 3 or maybe 4, but this is normal range. 2 to 3 is the normal range of stomach pH. So even at this pH, this bacteria can survive, and this bacteria is the, it it cause a infection that like that is H. pylori infection, and this infection can lead to duodenal ulcers. There are two kind of ulcers: stomach ulcers or gastritis or gastric ulcers, and second is duodenal ulcer, because this H. pylori bacteria is present at the bulb of duodenum, like at the start of duodenum. You know, for example, this is a stomach, so they are present at the junction or near at the bulb of duodenum. So that's why this bacteria is most commonly, it cause duodenal ulcer. About 99% causes of duodenal ulcer is H. pylori. Okay. So the patients who are having a recurrent gastritis, symptoms of gastritis, we can check this bacteria. We have different tests to confirm this bacteria, and then we can treat. But the treatment is very difficult. We should have to give the treatment for at least 14 days with 2 antibiotics. Okay, so this is a general overview about all the different type of bacteria which we have studied. This is single As I told you, like the bacilli may be present as a single or may be present as a double. So when it is present as double, we call it diplococci. When it is diplobacilli, when it is present as single, we call it simple bacilli. If it is present in a long chain form, then we call them streptobacilli. Okay, some bacteria, they are they have the shape similar to circular, as well as they are similar with bacilli. So those bacteria, they are known as cocobacillus. Why we call them cocobacillus? Because they are round, but they are also elongated. Like they are not completely circular, they are a bit elongated. So that's why we call those bacteria as cocobacilli. Remember this. This classification is according to the morphology of the bacteria. Okay, so we have different classifications. We have different classifications of bacteria according to their morphology, their structure, as well as their staining. Medically, we classify bacteria according to their staining. What is staining? Staining means coloring. So medically, when we talk about bacteria, we talk about gram-negative, gram-positive bacteria. As a morphology, when we talk about the structural morphology, we can classify the bacteria as cocci, bacillus, or spirochete. But medically, classification is different. So medically, gram-positive, gram-negative bacteria, acid-fast bacilli, we will discuss later. Okay. So this classification is according to their structure. Okay, so all the bacteria, they have a more like they have a cell organelles that we call the flagella or the flagellum, which helps for their movement. So all bacteria can move. Okay, so they can move with the help of flagellum. So some bacteria, they have they are uniflagellate. Some bacteria, they are multiflagellate. Uniflagellate mean that the bacteria only have a single flagella, while some bacteria, here you can see this bacteria, it has multiple flagella here. So multiple flagella. So we have a bacteria with a single flagella, and we have a bacteria which have multiple flagella. So we will discuss later about this cell organelles. The spirochete bacteria, they also have a flagellum. They have a axial filaments here. If you see here, this red color thing, lines. These flagella, these are actually the axial filaments which helps the spirochete bacteria for their movement. So they move because of these axial filaments. Okay, so when we discuss about the size of a bacteria, the size of bacteria is its range is between 0.2 to 5 micron meter. The smallest one is 0.2 and the largest one is about 7 micron meter. But the range is 0.2 to 5 micron meter. Like between this range, almost all bacteria, they comes within this, the size of bacteria, it comes within this range. The smallest bacteria is the mycoplasma, and the size of this smallest bacteria is equal to the largest virus. The largest virus, that is the pox virus. So the size of the smallest bacteria is equal to the size of the largest virus.
400 nanometer.
Yes, about nanometer. I forgot the exact size. I will check and I will let you know about this. And the largest bacteria, that is actually a bacilli. That's why this is we call the longest. So bacilli, the largest bacteria, that is the rod or a bacilli, because the bacilli, They are also known as rods bacteria because they are rod shaped. Okay, so that's why we call them rods as well. They have the size about 7 micron, and this size, our RBCs and yeast cells, they come within this range. So our red blood cell size is around 7 micron. So we can see these 7 micron under a simple microscope, light microscope. While most of the bacteria can be seen under a light microscope, they can be seen under a light microscope. But the longest rods, that is, the size of that rod is equal to the human RBC or a yeast cell. But normal range is 0.2 to 5 micron. Next, we have the structure. When we see the structure of a bacteria, there are two kind of structures. One is the common structure, and second, they are the specific structure. Before starting the structure, because I want to teach this thing after we study the morphology, so that's why I'm skipping this topic, that is gram staining. So I will teach you this gram staining at the end of this chapter. Okay, so I'm skipping now because now you just need to know about what is gram staining and how we classify. As I told you that the gram staining is a staining technique. It's a staining technique in which when we provide a dye, carbofuran is a dye. It's a coloring agent. When we uh, when we apply a dye on a bacterial cell, some bacteria they retain the dye, some bacteria they don't retain the dye. You know what is retaining? Like they change the color. So we have, so those bacteria which retain the dye, they are known as gram positive bacteria. And those bacteria who do not retain the dye, those are known as gram negative bacteria. So gram positive bacteria under a microscope can be seen as bluish cell, while gram negative they look like about pink to red color. Pink to red color. They retain, like when we do this staining technique, so at the end of the staining technique, we have gram positive and gram negative bacteria. Just for an overview, just for an overview about the gram staining. So this is actually a staining procedure, gram staining. Why we call them the gram staining? Because this staining or this technique, it was discovered by the scientist. His name was Christian Graham. His name was Christian Graham, and according to his name, we call this staining technique as a gram staining. And it is very important technique, especially in microbiology, because all the bacteria we classify medically as in gram negative or gram positive. So as a simple staining, as a general, in this technique it actually involves a 4-step procedure. We have a crystal violet dye, and we have the iodine solution, and we have this carbofuran. Some bacteria, when they retain the dye, when they retain a dye, they actually produce a bluish color. Some bacteria, they do not retain a dye, but they stain but they retain some other dye, that is we call the saffronin stain. They look like as a pink to red or a purple color. So those bacteria, they are known as a gram negative bacteria. I know it is a bit difficult, so that's why I skip this topic till the end of this lecture, just to show you how this gram positive, gram negative bacteria it looks like. Let me check. Okay, here you can see these bacilli. These their color is about red, about pinkish to red color. So these bacteria are gram positive or
Negative.
negative? Yeah, gram negative. Very good. These
Negative.
bacteria are gram negative. The same here. These bacteria they are gram negative. Let me check if I have gram positive bacteria here. Okay, no here. What is this color?
Bluish.
Oh,
No, they are not bluish. They are still pinkish in color. So they are also gram negative. Let me check if I have gram positive cocci. Mm, Here you can see the color, this color, it's blue, but it is not that much clear. That's why I skip. But this is gram positive bacteria. This color, this is a bluish color. Let me check if I can find some other good picture of gram positive bacteria. Okay, just here. Okay, here it will be easy for you to distinguish. Can you see? Can you see this color? Blue color?
yes,
Bluish color?
sir. Yes, sir.
Okay, so this bluish color bacteria, they are known as gram positive, and this is actually a pinkish, reddish, or purplish color is actually gram negative bacteria. So this is a major classification. We will discuss later about this gram staining technique and how we classify and which bacteria comes under gram negative and gram positive medically. We will discuss later about it. So these, because these are the two bacteria and their composition is also different. So that is why bacterial structure, gram positive bacteria and gram negative bacteria, both bacteria have some common structure and they also have some differences, because gram positive and gram negative bacteria, their composition is not same. They have some structures they are common, but some structures they are specific. Specific mean they are only present in gram positive or only present in gram negative. So for example, this is a simple bacterial cell, and we know that the bacteria is a prokaryotic cell. So prokaryotic cells, when we generally speaking, the prokaryotic cell, we have a cell wall and we have a cell membrane. So cell wall is the outermost membrane of a prokaryotic cell, and then we have a cell membrane which is inside the cell wall, and then we have a inside the cell membrane we have a cytoplasm, and within the cytoplasm we have different cell organelles. This is a typical or simple prokaryotic cells. So bacteria is also a prokaryotic cell, so they also have the similar structure. So we have a cell wall, we have a cell membrane, And cell membrane is also known as plasma membrane, cytoplasmic membrane, different. So cytoplasmic membrane or a simple cell membrane, and then we have a inside we have cell organelles. We also have a flagella. One by one we will discuss these structures. So first let's discuss about the common structure which are present in both gram negative and gram positive bacteria. Gram positive bacteria and gram negative bacteria both contain the cell wall. Their cell, it has a cell wall because both are prokaryotic cells. So the cell wall of gram positive and gram negative bacteria, they are made up of a peptidoglycan units. So peptidoglycan is what? Peptidoglycan is actually, as the name suggests, peptidoglycan. Pepti mean protein, amino acid. Glycan mean sugar. So later we will discuss. So the cell wall of a bacteria, it is made up of peptidoglycan unit, both for gram negative and gram positive. There is one exception, Mycoplasma species. Mycoplasma, that is the smallest bacteria. In Mycoplasma species, the outermost membrane is a cell membrane. There is no cell wall. So this is a some exception. But rest of all the bacteria, they have a cell wall. Okay, so they are the outermost membrane, that is a cell wall. But Mycoplasma, their outermost membrane is a cell membrane. So this is an exception. The cell wall, it is external to the cytoplasmic membrane, and that cell wall is made up of peptidoglycan unit. And this peptidoglycan is actually it provides shape, strength, and resistance to the cell. Okay, class, any question?
No, sir.
So gram positive, gram negative both have the cell wall, but the difference is gram positive cell wall is multi-layer. We have it's multi-layer, and more thick. It's multi-layer and thick, while the cell wall of a gram negative, it is single layer. It's single layer and thin. And there is another difference between gram negative and gram positive bacteria. The outermost membrane of a gram negative bacteria is not a cell wall. There is another membrane that is known as the outer membrane, which is present outside the cell wall. So this is a difference between gram positive and gram negative bacteria. So gram positive, the outermost membrane is a cell wall, while the gram negative bacteria, the outermost membrane is a outer membrane, and within the outer membrane we have a single layer cell wall. And then we have a space. There is a space between a cell wall and the plasma membrane, and the space between the cell wall and the plasma membrane is known as periplasmic space. The space between the outer membrane, the cell wall and the cell membrane of a gram negative bacteria, there is a space that is known as periplasmic space. And clinically it is important because we have certain enzymes, especially beta lactamase enzyme, it is produced here and it is stored here, And this beta lactamase enzyme is a resistance against certain antibiotic. We will discuss later about it. So let's start the explanation of a cell wall. So peptidoglycan is a single bag-shaped cross-linked. It's a macromolecule. It's a macromolecule which is present outside the cell membrane. As I told you that uh, the gram-positive bacteria, the outermost layer or the cell wall is thick as compared to the gram-negative bacteria. Another important thing is this peptidoglycan. If we see the structure here, we have this gram-positive and gram-negative. So gram-positive bacteria, we have a cytoplasmic membrane and we have cell wall. So the cell wall is composed of a peptidoglycan units. So peptidoglycan, the peptidoglycan units, and from the peptidoglycan units, there are certain fibers. They are protrude outside, especially in gram-positive bacteria. If you see the picture here, this is a peptidoglycan, and from the peptidoglycan, some fibers they are protruding outside, and these fibers they are actually made up of teichoic acid. These are the fibers. So they protruded outside from the peptidoglycan. But in gram-negative bacteria, there is no teichoic acid. So this is a difference between gram-positive and gram-negative bacteria. So gram-positive bacteria, although both have peptidoglycan unit in their cell wall, but teichoic acid fibers, they are only present in gram-positive bacteria, not in gram-negative bacteria. So the peptidoglycan layer is more thick in gram-positive as compared to gram-negative. While when we see the gram-negative bacterial cell wall, this is a cell wall of gram-negative bacteria. So the gram-negative bacterial cell wall, there is another membrane which is present outside, which is present outside the cell wall, that is known as outer membrane. It is made up of different components. That is made up of layers of polysaccharides, especially lipopolysaccharides, lipoprotein, phospholipids. Okay, so these are the components which are present in outer membrane. Gram-positive bacteria and gram-negative bacteria both have their cell wall is composed of peptidoglycan units, but gram-positive bacteria, because there is only a cell wall, so that is why peptidoglycan is very thick and multi-layer. You can see here 1 layer, 2, 3, 4 layers. While in gram-negative bacteria, the cell wall is a single layer. You can see here, this is a single layer. And outside the cell wall, we have an outer membrane. Teichoic acids are the fibers which are protruded outside from the peptidoglycan units in gram-positive bacteria. While in gram-negative bacteria, there is no teichoic acid. While the outer membrane of a gram-negative bacteria is composed of lipopolysaccharide, phospholipids, and polysaccharides. Just wait, we will discuss in detail about this. Yes, class? Understood?
Yes, sir.
And the most important, clinically important thing is the distance, the space which is present between this cell wall and the inner membrane. That is a uh,
Periplasmic
sorry,
Periplasm space.
yes, which sorry,
periplasmic
the
space.
periplasmic space that is
Periplasmic.
present between the cell wall and the inner membrane, or a we can say the plasma membrane, cytoplasmic membrane, sorry, cytoplasmic membrane. So this is known as periplasmic space, and this periplasmic space, I told you that it is clinically important or medically important because this periplasmic space, there is a presence of one enzyme that is known as beta lactamase. Beta lactamase. Beta lactamase is an enzyme which degrade, which break down a beta lactam ring. Beta lactam ring. What is beta lactam ring? Beta lactam ring is actually a it's a chemical, it's a structure, beta lactam ring, that is present in antibiotics, especially penicillin. Penicillin and cephalosporins. Cephalosporins. These two, these two are actually the classes of antibiotics, penicillins and cephalosporins, and the structure of these drugs contain beta lactam ring. And these drugs are known as, these two classes of drugs are known as beta lactam antibiotic.
Sir,
Yes,
sir, penicillin and cephalosporin both contain beta-lactam drugs, or one of them?
both classes. These are the classes,
Okay.
not a drug. Okay, penicillin contain lot of drugs. For example, in pharmacology, you will study in detail amoxicillin, ampicillin, cloxacillin, ticarcillin, piperacillin. Okay, so these are the drugs which belong to penicillin group or
Yes,
penicillin
sir.
class. Cephalosporins, again, we have lot of drugs under this cephalosporins. For example, we have cephradine, cephalexin, cefaclor, cefexime, ceftriaxone, and yeah, so many. You will you have to remember when you in pharmacology. So these two classes or group of antibiotics, they are beta lactam antibiotics, or we can also call them cell wall synthesis inhibitor. These are also known as cell wall synthesis inhibitors. Why they are known as cell wall synthesis inhibitor? Because they block the synthesis of, they actually block the they block the transpeptidation of this peptidoglycan unit. Just wait, I will explain later about this. So just remember, they inhibit the cell wall synthesis. But this beta lactamase or lactamase enzyme, it degrade this beta lactam ring which is present in the drugs, in these drugs. And you know the antibiotic or antibacterial effect, the antibacterial effect of these agents or these drugs, they are due to this beta lactam ring. And when you break down this beta lactam ring, their antimicrobial effect will lose. So that is why gram negative bacteria, they produce, not gram positive, because there is no periplasmic space. Only gram negative bacteria, they have ability to produce this beta lactamase enzyme which degrade these drugs. That is why it is very difficult to treat gram negative infections. Very difficult. Nowadays, nowadays we also have a extended beta lactamase inhibitors. Sorry, not beta lactamase inhibitor, extended beta lactamase enzyme. Like these two drugs, they can be like degraded by this beta lactamase. But we also have certain advanced drugs which can also be degraded by this beta lactamase. So that is why we those drugs are known as extended beta lactamase inhibitors. More details you will study in pharmacology. So just remember for microbiology, just remember about this beta lactamase enzyme, where it is present, and it is the most you can say troublesome enzyme, because sometimes it's very difficult to treat gram negative infections.
Sir,
Okay.
it means they are mostly resistant to antibiotic drugs.
Yes, they cause resistance, and most of the MDR multi-drug resistant infections, most common bacteria they are involved that are gram negative bacteria, like Klebsiella pneumoniae, very commonly very resistant strain. E. coli, it's a gram negative. Essentia coli is a name, very commonly involved in urinary tract infections. Uh, that is very resistant. Like my mother, she's diabetic, and I remember one time she was in diabetic patient, urinary tract infections are very common. She was having urinary tract infections, and we found this Klebsiella pneumoniae, that is a gram negative bacteria. And when I performed this culture sensitivity test, that bacteria was resistant to almost all the drugs. Only 2 or 3 drugs, the bacteria was sensitive. Only 3 drugs. So anyhow, sometimes it's very difficult to treat this gram negative infections. Okay, so peptidoglycan, let's come back to the cell wall. So peptidoglycan, what is peptidoglycan? I told you it's a repeated unit of peptidoglycan. Pepti mean amino acid, glycan mean sugar molecule. So peptidoglycan is made up of sugar molecule as well as the amino acid. Okay, so we have less than a minute. If you have any question, you can ask. After a break, we'll continue.
माइक बड़ा खतरनाक लगाया हुआ है तूने भाई.
किसको कह रहे हो आप?
हमजा को, हमजा मजीद.
क्या
मौलवी
हुआ?
क्या हुआ?
अरे मौलवी